is an interesting one. This one really relates to toileting hygiene. Lower body dressing, M1820 and M1845, kind of go hand in hand. So you really have to think about the logistics of going to the toilet, taking your pants down, doing your business, being able to wipe adequately, being able to clean yourself appropriately. How much help do you need with that? It really depends on if the patient, do they have the ability to not have pain and not have shortness of breath? Are they physically able to do that without assistance from another person? And most of the time they're going to need some level of assistance, whether it's a setup of perineal hygiene or wipes at the toilet side, something like that, or it could be that they need the assistance of a person just to support them as they're getting up from the toilet, getting on and off the toilet, or it could be that they need a lot of help. They might be completely dependent on two people to lift them up and down to use the toilet. So there's a lot of things to consider for this item.
Yeah, this one can get kind of busy. Another thing I'm seeing is some of the clinicians will mark a response 3, and that indicates that the patient is completely dependent. So they'll mark a response 3, but PT may say max assist, right? So I think they're getting it wrong sometimes there.
Yeah.
They're saying the patient's completely dependent when really they're not. They require a lot of assistance. But you have to remember a response 3 is if they have to be completely dependent and give no help whatsoever. The other one is a response 0. You got to think about that. That's not likely that you're going to see that in home health, because if you see that, then you have to question, why are we out here, right?
And I think it's important to remember that when you're in the home, the clinician really needs to get that patient up. You need to get the patient up, ask them to walk to the bathroom, and they can keep their clothes on. They don't have to pull their pants down or anything, but just to ask the patient to sit on the toilet, and then to ask the patient, to sit for 5 seconds and then to get themselves up. You can get a lot of information out of asking about that one task. That's just doing the OASIS walk and making sure that you're observing, because a lot of patients, they might tell you, I can get dressed just fine. I can do, toileting hygiene is no trouble for me. Of course they're going to say that, but really OASIS, it relies heavily on observation and that assessment. So it's really important to educate your clinicians.
Are they safe doing it? That's
right.
That's the biggest part to remember on M1845 or with all the M1800 items.
Right. Safety is key.
Thank you for joining us for this episode of Coding Corner, brought to you by HealthRev Partners. Grow your agency and expand your mission with a high-power revenue cycle management partner, powered by Velocity, the most advanced coding and billing software in the market for transparency, analytics, and clinical intelligence.